Hey future nurses, how are you all doing? I hope you all are coming from the first video because and if you are new here, I am Nurse Funke. Welcome. Now I made the first part video and then we are continuing here with the Nclex review. Now today's topic is the dreaded acid-base imbalance and ABG interpretation. So I made the first part video explaining acid-base imbalance, the key terms you need to know, the key terms you will see in ABG interpretation, and you have to understand it. So it will be beneficial for you to go review that before coming for this review. So in this review, we'll be dealing with Nclex style acid-base imbalance questions with ABG interpretation practice questions too. So watch till the end. It is very, very important, okay? And as always, don't forget to check out my website for the Master Method Study Guides. It contains 11 body systems and over 120 Nclex most tested disorders, okay? So please don't forget to subscribe. Don't forget to like if you enjoy my teaching. Don't forget to share this video to other nursing students that will benefit from these videos, okay? Now, let's go right into our questions of the day. Now, first question. The nurse reviews a client's atrial blood gas results, and the result is the pH is 7.40. Okay, now which statement best describes this result? A, the blood is acidic. B, the blood is alkaline. C, the blood is within normal range. And D, the blood is uncompensated. All right, guys, let's break this down. Now, in acid-base imbalance, listen to this. Think about a swing with two seats and two people are seated on this swing. One goes up, one goes down. One goes up, one goes down. So acid goes up, base goes down. Acid base up, goes up, base goes down. That's acid-base imbalance. But guess what? The body wants the swing to be balanced. The body wants the pH to be balanced. And that is why acid-base balance is the balance between acid and base. And how do you know that acid and base are balanced in the body? You know this by measuring the blood's pH. You know that acid and base are balanced in the body by measuring the pH of the blood. And that is why pH itself tells us how acidic or how basic the blood is. Okay? Now, the question is asking us, what does a pH level of 7.40 means? Now, normal pH range is 7.35. Look at my hand, 7.35 to 7.45. Now on this side, look, this is the acid side, and here is 7.35, and on this side is the base side. Here is 7.45. Now listen, if the pH goes below 7.35, that will put the body in a state of acidosis, and if the pH goes above 7.45, that will put the body in a state of alkalosis, that is too much alkaline or base in the body. So the pH we have here is 7.40. This is within the normal range. So the right answer is C, the blood is within normal range. 7.40 is within normal range. So that's our right answer. Now let's go through the wrong choices. A says the blood is acidotic. No, I told you the normal range is 7.35, which is on the other side, and 7.45, which is on the base side. This is acid, this is base. When it falls below 7.35, we are leaning toward acid. So then you can say the blood is acidic, but the range is 7.40. This is within the normal range. So this is wrong. Now, B says the blood is alkalotic. No. If the range given to us falls above 7.45, then we'll say it's alkalotic, but the range given to us is within the normal range for pH. Okay, so this is wrong too. And D says the blood is fully compensated. How do you know it's fully compensated? You need the remaining two systems, the lungs and the kidney, to be able to decide if it's fully compensated. You cannot talk about compensation without the remaining two systems. You cannot talk about compensation with just pH range. You need the remaining system, the lungs and the kidney, to be able to decide, because they are the one that will do the work of compensation. So we'll be able to decide if it's fully compensated. So pH range alone cannot be used to decide or determine if the blood is fully compensated. So this is wrong. Now next question, guys. Miss B is a 23-year-old present after a panic attack. She is breathing rapidly. ABG. The pH is 7.52. Now, the CO2 is 30 and the CO3 is 24. What is the best interpretation now? Like I told you guys, always you look at your pH first, and then you look at your CO2, and then you look at your CO3. Okay, now the pH range is 7.35 to 7.45. We know that when the pH goes below 7.35, we are leaning towards the acid side. And when it goes above 7.45, that is the basic side. We are leaning towards the base, okay? And CO2, now, when it goes below 35, we are going towards the base side. And when it goes above, when the number given goes above 45, we are leaning towards the acid side. Last one, CO3. When the CO3 goes below 22, we are leaning towards the acid side. And when it goes above 26, we are leaning towards the base side, okay? So when you draw out your chart, this is what you should have: ABA on one side and BAB on the other side, okay? Now, let's interpret. pH is 7.52. Where does that fall? That goes above 45. So we are dealing with base here. Our pH is base, okay? Now, CO2 is 30. And where does that fall? Look, 30 falls below 35. And you know, I told you, once you figure out your pH, you have to find a match for your pH to be able to interpret the ABG. Okay, now our CO2 is 30. Our CO2 is 30, which falls below 35. And what does that say? It says our CO2 is leaning towards the base. So our CO2 is also base. Ta-da! We find a match for pH. So if you interpret what we have right now, what do we have? We have respiratory alkalosis. Do you understand? We have respiratory alkalosis because the CO2 is also on the base side and the lungs control the CO2. That's why we have the respiratory. And the pH is also on the base side, and that we have alkalosis. So we have respiratory alkalosis. Now we want to know, is it compensated or uncompensated? To know if it's compensated or uncompensated, look at your CO3. Since you figure out this, now look at the CO3. The CO3 is 24. 24 falls within the normal range. So this is normal. Okay, the kidney is in normal state, while pH and CO2 are out of range. So we have respiratory alkalosis, uncompensated, because the kidney is not trying to help. I told you, when the lungs is in trouble, the kidney help by increasing or decreasing itself. When the kidney is in trouble, the lungs should help by increasing or decreasing itself. But look, the kidney is just sitting right there, it's not trying to help. Because in this state, if the kidney were to help, since we are in state of alkalosis, the kidney is supposed to increase its acid to help balance out the state of alkalosis, and that will help to put the pH in normal range. So we have uncompensated, we have uncompensated respiratory alkalosis. Guys, pardon my handwriting. Uncompensated respiratory alkalosis. That's what we have. Okay, guys? So let's move on. Second question. Which ion is the primary base that the kidneys regulate to control metabolic acid-base imbalance? To control metabolic acid-base imbalance. A, CO2. B, hydrogen ion. C, bicarbonates, which is HCO3. And its short form for it is bicarb. And D, chloride. Pick your answer. Guys, the right answer is C, bicarb. Now, there are three key players in acid-base balance. CO2, which is controlled by the lungs. Bicarb, which is the HCO3, is controlled by the kidney. And that's the base, the only base in acid-base imbalance. And then hydrogen ion, which is I acid. So to remember it, I call it hydrogen acid. Okay? So the only base in acid-base imbalance is bicarb, HCO3. And it's controlled by the kidney. Okay? So let's go through the wrong choices. A says CO2. I just said it. That is acid. CO2 is controlled by the lungs and it is acid. So when there's so much CO2, the body will be in respiratory acidosis. When there's so much accumulation of CO2 in the lungs, that will put the body in a state of respiratory acidosis. And remember, gas exchange happens in the lungs. CO2 out, oxygen in. Gas exchange in the lungs. So the primary base that kidney regulates is not CO2. So that is wrong. And B, hydrogen ion. From my explanation, I told you that hydrogen ion is acid, I acid, and it is controlled by the kidney. so it is not base. So that is wrong. And D, because C is our right answer. D says chloride, right? It is an important electrolyte, and shift in chloride can affect acid-base balance, but it is not the base. We are looking, the question is asking us the base that is controlled by the kidney, which is bicarb. Okay, so that also makes it wrong. All right, now let's do our ABG interpretation questions. Okay, now Mr. A is a 68-year-old with COPD. He arrives complaining of progressive dyspnea on exam. Okay, now ABG, the pH is 7.28, the CO2 is 56, and the HCO3, the CO3 is 26. What is the best interpretation? Now guys, listen to this explanation. When you get your ABG questions, okay, the first thing you want to look at is your pH. Okay, always look at your pH first, and the next thing you want to look at is your CO2. So use these two to remember that after looking at your pH, the next thing you want to look at is your CO2, and the last thing, the third thing you want to look at is your CO3. Okay, this is the table I use always for my ABG interpretation. Okay, now we have pH. pH range is 7.35 to 7.45. Okay, now 7.35 is, as you can see it here, A, acid, on the acid side, and then 7.45 is on the base side. So when the number falls below 7.35, we are leaning towards acid. That means the pH is instead of acidosis. And when we are leaning towards above, when the number falls above 7.45, that is basic. Okay, now the CO2, 35, normal range is 35 to 45. Okay, now the 35 is on the base side and the 45 is on the acid side. And CO3, the normal range is 22 to 26. Okay, the 23 is on the acid side and the 26 is on the base side. So by the time you draw out your chart, it's going to give you ABA on one side and BAB on the other side. Okay, now let's interpret it. pH is 7.28. Look at our range. That goes below 7.35. So it's telling us that we are dealing with acidosis. So our pH is in acidosis. Now, to be able to know if it's respiratory or if it's metabolic acidosis, now you have to pair the pH with one of these, either the lungs or the kidney. And how do you know which one to pair it? You have to look at the number given to you. Look at your CO2. The CO2 is 56, which means the lungs is also filled with acid. So the lungs is also in state of acidosis. And look at the last one. The last one, HCO3, is 26. Now 26 falls within the normal range. So 26 is within the normal range. Now let's interpret it. Our pH is on the acid side and our CO2, which is the lungs, is on the acid side. So we have what? We have respiratory acidosis, because they both match. They are both in state of acidosis, both the lungs and the pH. Now we want to know if it's compensated or uncompensated. What is compensation? This means helping each other. Compensation is when the kidney is in trouble, the lungs help. When the lungs is in trouble, the kidney help. They have those brotherly relationship, bro code. Okay, so now, but look, we have respiratory acidosis, but the kidney is normal, in the normal range. Because for it to be compensated, the kidney have to help. The kidney have to help the pH and the lungs, because they are in state of acidosis. So how the kidney can help is by increasing itself, increasing its base. To help, if the kidney increase its base, that will help to neutralize the state of acidosis. But the kidney is just normal, sitting right there, not trying to help. So what we have is uncompensated respiratory acidosis, because the kidney is normal and it's not trying to help. That's why we have uncompensated respiratory acidosis. The kidney is not trying to help. Now the next question: the nurse is caring for a client with respiratory acidosis. Now, which condition could be the cause? A, anxiety attack; B, opioid overdose; C, hyperventilation; and D, vomiting. Now let me tell you what's going on here. Respiratory acidosis. What is respiratory acidosis? When you're hearing respiratory, you know we're talking about the lungs. Okay, and gas exchange happen in the lungs. CO2 out, oxygen in. So when you hear respiratory, know they are talking in ABG interpretation, we are talking about the lungs. Now, acidosis, the CO2 that is exhaled is acid. The CO2 is one of the key players in acid-base balance. So the CO2 is acid. And now, when there is accumulation or retention of CO2 in the lungs, that will put the body in state of lungs, respiratory acid overload in the lungs, acidosis. That will put the body in state of respiratory acidosis. Okay, now listen to this. Any condition that will cause you to hypoventilate, any condition that will suppress the respiratory rates, that will slow the breathing, that will slow down the breathing, will cause respiratory acidosis. Okay, because when the respiratory rate is slowed down, CO2 is retained. There is much CO2 retention in the lungs. Respiratory acidosis. That will put the body in state of acidosis. So conditions like central nervous, like taking medications that suppresses the central nervous system depressant, opioids overdose, like overdosing on morphine, hydromorphone, benzodiazepines, alcohol. All of this will suppress the central nervous system. They will cause respiratory suppression or depression, and that will lead to CO2 accumulation in the lungs, respiratory acidosis. Okay, I think I've actually explained. So our right answer is B, opioid overdose. I explained it because, like I said, when anyone overdose on opioids, it will bring the respiratory rate down. It will suppress respiration. So that's why our right answer is opioids overdose. Now, A says anxiety attack. No, anxiety attack will cause hyperventilation. And I told you, any condition that causes hypoventilation will cause respiratory acidosis. So anxiety attack will be seen in respiratory alkalosis. Now, C, hyperventilation. Hyperventilation will be seen in respiratory alkalosis because you're hyperventilating, you are blowing off all that CO2. Now the body becomes basic. You've blown off all the CO2. So the body becomes basic. So the body will be in state of alkalosis. So that is wrong. And D, vomiting. Vomiting will cause metabolic alkalosis. Because think about it. Think about the stomach. The stomach contains gastric contents. And the gastric content in the stomach is acidic. Now, when someone vomits, when you vomit, you are vomiting all the gastric content, which is acid, out. That will leave the body in state of alkalosis. And we're talking about metabolic, we're talking about kidney, respiratory, lungs. In ABG interpretation, when you're hearing respiratory acidosis, respiratory alkalosis, they're talking about lungs. When we're talking about metabolic acidosis, metabolic alkalosis, we're talking about kidney, metabolic, kidney. I hope you understand. So you vomiting because you vomit out all the acid in the stomach. That will put the body in state of alkalosis. So vomiting will not cause respiratory acidosis, will cause metabolic alkalosis. Okay. Now, next question. Mr. C is a 45-year-old with type 1 diabetes who missed insulin doses. Now, he has small respiration. pH is 7.22, CO2 is 30, and CO3 is 12. Okay. As always, we look at our pH first, then we look at our CO2, and then we look at our CO3. Okay. And then with your charts, you should have ABA on one side and BAB on the other side. Okay. Now, let's look at our pH. pH is 7.22. Now, I told you when the number falls below 7.35, we are leaning towards the acid side because 7.35 is on the acid side. So now this number falls below 7.35. So our pH is on the acid side. Okay. Now, our CO2 is 30. I told you when the CO2 falls below 35, because 35 is the base side. So when it falls below 35, what do we have? We are leaning towards the base side. Okay. So our CO2 is base. And remember, I told you to be able to interpret ABG, you have to match the pH with one, either the lungs or the kidney. Now we do not have a match yet. You see, because the CO2 is on the base side, but our pH is on the acid side. Now let's look at the last one, the kidney. What is the kidney doing? Now the kidney is 12. And what is that? 12 falls below 22, and 22 is on the acid side. So our kidney is in state of acidosis. Yay, we have a match. The pH is matching with the kidney. So when we have the kidney and the pH, we have metabolic. No, when they are talking about kidney, we are talking about metabolic, and we are talking about lungs, we are talking about respiratory. So now we are in state of metabolic acidosis. But is it compensated or not compensated? Now let's look at this one, the CO2, since we've already matched pH with HCO3. So we look at the one that is left unmatched to be able to determine if it's compensated or uncompensated. Now our CO2 is 30. Now look at this. I told you when for compensation to happen, the kidney have to help the lungs have to help the kidney. Now our CO2 is 30, which means our CO2 is out of range, also out of range. What is the CO2 trying to, what is the lungs trying to do? The lungs is trying to compensate, because for it to compensate, it has increased itself. Look, it's 30. That means it has increased its base, because we are in state of metabolic acidosis, and it has increased its base to be able to neutralize the state of acidosis, but it is not there yet. The lungs is trying all it can to pull out the pH and CO2 out of state of acidosis, but it is not there yet. So we have partially, because it is trying, it has increased itself. If it's not trying at all, it will be in the normal range. But it has tried to increase its base to neutralize the state of acidosis the body is experiencing. So we have partially compensated metabolic acidosis. Metabolic. Remember, it's the kidney that was matched with the pH. Metabolic acidosis. Please forgive my handwriting. That's what we have. Next question says, which of these cause metabolic alkalosis? A, diarrhea. B, renal failure. C, repeated vomiting. And D, aspirin overdose. The right answer is repeated vomiting. C. I have just explained to you that when someone vomits, they are vomiting out all the gastric content in the stomach, and that will put the body in state of metabolic alkalosis, because all the acid is gone. Now the blood is basic. What is left is the base, alkaline. So that will put the body in metabolic alkalosis. Okay, now let's go through the wrong choices. Now A says diarrhea. Now let me explain it to you. Think about the intestine. The intestine is filled with base, more of base than acid. So filled with base. When someone have diarrhea and they poo, they are pulling out all the base out from the intestine. You know, we're talking about acid-base imbalance. They are pulling out all the base. And when someone pulls out all the base in the body, what is left in the body? That will leave the body in the state of metabolic acidosis. And the question is asking us about metabolic alkalosis. So A is wrong. So think about it. Base comes out of the butt. So that will help you to remember that when someone when you have diarrhea, they are pulling out base and not acid. And when you pull out all the base, you'll be left with acid in the body. So that will put the body in state of metabolic acidosis. Okay? B says renal failure. I explained to you, renal failure will cause metabolic acidosis, because that kidney failed, acid will prevail. It will be unable to excrete the acid out through the urine, and that will accumulate and cause metabolic acidosis. Okay, so that is wrong. Now D says aspirin overdose. Now aspirin is also known as the salicylate. Okay, and when someone takes aspirin too much for too long, the salicylic acid in aspirin will build up, in that will cause metabolic acidosis. And what we are asking about here is metabolic alkalosis. So that makes aspirin overdose wrong. So aspirin overdose will cause metabolic acidosis. Now let's move on. A patient with an opioid overdose is drowsy and breathing slowly. Which acid-base disorder is the nurse most likely to find? Respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. I just explained it. The right answer will be respiratory acidosis. You see this? A patient with opioid overdose, remember that those are one of the things I told you will cause respiratory acidosis. Now, drowsy and breathing slowly. I told you anything that will cause you to breathe slowly, that will suppress respiratory rate, will cause respiratory acidosis, and it's confirmed in this question. So the right answer is respiratory acidosis. Now, B says respiratory alkalosis. I just explained anything that will cause you to hyperventilate will cause respiratory alkalosis. Like anxiety attack will cause respiratory alkalosis because you are panting, you are blowing off all the CO2. After a dog chase, you run so fast and you stop and you're blowing off all the CO2. That will also cause respiratory alkalosis. Okay, so according to the question, breathing slowly, drowsy and breathing slowly, that will cause respiratory acidosis, not respiratory alkalosis. So B is also wrong. Now C, metabolic acidosis. This is wrong. Now, what will cause metabolic acidosis? Remember what I told you when we're talking about metabolic, we're talking about the kidney. When we're talking about metabolic acidosis, is the things that can cause metabolic acidosis will be renal failure, because the kidney controls the hydrogen ion, which is acid and bicarb. Now, when the kidney fails, acid will prevail. So now when the kidney is not functioning well or kidney fails, the kidney is not able to excrete the hydrogen ion out through the urine, because hydrogen ion is high acid. That's why I call it hydrogen acid. So now that acid is retained in the body, and that will put the body in state of metabolic acidosis. DKA will put the body in state of metabolic acidosis. Go review that video. Because when the body starts burning down fat as fuel, because there is lack of insulin to shift blood sugar into the cell, the body starts burning down fat as fuel. That process will lead to ketones production. And ketones, they are acidic waste that will build up in the body, and that will lead to metabolic acidosis. So D is also wrong. So our right answer is only A. All right, guys, let's go to the next one. I'm not going to explain too much. We'll just go straight to our ABG interpretation. Okay, now what do we have? Our pH is 7.49, our CO2 is 48, and our CO3 is 34. Let's interpret it right away. Now the pH is 49. Look, the pH is going towards the base side, because when the number goes above 7.45, we are leaning towards the base. So our pH is now, the number is 49, so we have base for the pH. Okay, remember the pH have to be paired or match with one of them, without the lungs or the kidney. Now let's find a match for the pH. Now the CO2 given to us is 48. Now look here, when the number goes above 45, we are in state of acidosis. The lungs are in state of acidosis. So look, so and the pH, the CO2 given to us is 48. So we are dealing with acid with the lungs. Acid. You see, there is no match yet, right? Now let's look at the last one, the kidney. The CO3 given to us is 34. Now, when the number goes above 26, we are leaning towards the base. So, and what we are given is 34. So we are going towards the base. So our kidney is in state of alkalosis, B. Yay, we have a match for pH. Now, the pH is on the base side, and the kidney is also on the base side. What do we have? Remember, when we are talking about kidney, we are talking about metabolic. So we have metabolic, and this is base, alkaline. We have metabolic alkalosis. Do you get it? Now, let's know if it's compensated or uncompensated. Okay. Now, the CO2 is what? It's on the acid side. Guess what is happening? The lungs are trying to compensate. Now, the body is in state of metabolic alkalosis. So the lungs has increased its acid to try to neutralize the alkalosis, the state of alkalosis, so that the pH can be in normal range. But guess what? The pH is still out of balance. So we have partially compensated metabolic alkalosis, because the lungs is trying to help, but it's not there yet. When you have compensated, the pH will be in normal range, but the lungs is trying to help. It has increased its acid to help neutralize the metabolic alkalosis, the state the body is experiencing, but it is not there yet. So we have metabolic. Remember, it is the kidney that was matched with the pH, so that's why we have metabolic alkalosis. And that's our final answer. Which medication can contribute to metabolic alkalosis? A, aspirin, which is salicylate overdose. B, morphine. C, antacid overuse. And D, acetaminophen. Guys, the right answer is C, antacid overuse. Let me tell you. Now, in metabolic alkalosis, it means there is less acid in the body and there is more of bicarb or base in the body, because all the acid has gone out of the body. Now, I said the right answer is antacid overuse. What is the function of antacids? They neutralize stomach acids. And after all this acid in the stomach has been neutralized, what is left? The body will put in state of metabolic alkalosis. No more acid in the stomach. So the stomach content is now basic, and that will put the body in state of metabolic alkalosis. Antacid also contains bicarbonate, which is the bicarb, HCO3, and other alkaline substances. So it's like we are neutralizing stomach acid and adding more bicarb. So the acid is gone, base is left, and that will put the body in state of alkalosis overload. So that's why right answer is C. Now let's go through it. A, aspirin overdose. I have explained to you that aspirin overdose will cause metabolic acidosis. Aspirin is acidic. It is salicylic acid, and that will accumulate over time and cause the blood to be acidic or increase the acid in the blood. So that will cause metabolic acidosis. B says morphine. What do you know about morphine? They are central nervous system depressants. They will depress the central nervous system. And anything that will depress the central nervous system will cause CO2 retention. And that will lead to respiratory acidosis, not metabolic acidosis. Oh. Okay? So B is also wrong. C is our right answer, and D says acetaminophen. Acetaminophen is not an acid-based destructor. High dose of acetaminophen will damage the liver, but they do not directly have any effect on the pH in the body. Okay, so that is wrong. The nurse monitors the client with respiratory alkalosis. Which situation is most likely the cause? A, COPD. B, pneumonia with retained secretions. C, anxiety or panic attack. And D, opioid toxicity. Guys, the right answer is C, anxiety or panic attack. What are we talking about? We are talking about respiratory alkalosis. And I told you anything that will cause you to hyperventilate will blow out or blow off all the CO2 and put the body in state of respiratory alkalosis. Any condition that will cause you to hyperventilate, any condition that will increase the respiratory rate, and that will cause you to blow off CO2 in the lungs, that will put the body in state of alkalosis, and that's respiratory alkalosis. So, and that is why our right answer is anxiety or panic attack, because anxiety or panic attack, when you are anxious or you have panic attack, you can't breathe. You are blowing off too much CO2. That's why our right answer is C. Now, COPD. COPD will impair gas exchange, will cause airway obstruction, and that will lead to decreased respiratory rates. That will lead to respiratory acidosis and not respiratory alkalosis. Because any condition that will decrease the respiratory rate, that will cause you to hypoventilate, will cause you to retain CO2. And COPD is one of those conditions. Asthma, COPD, pneumonia will cause you to retain CO2, will decrease the respiratory rate and cause you to retain CO2. That will put the body in state of respiratory acidosis. But what they're asking about is respiratory alkalosis. So A is wrong, COPD is wrong. Now, you see, B, I've just even said it, pneumonia with retained secretions. I just said it, pneumonia. The retained secretions will cause impaired gas exchange. That will cause you to retain CO2. And that will cause respiratory acidosis, not respiratory alkalosis. And D, opioid toxicity. Again, opioid suppresses the central nervous system, the decreased respiratory rate. And that will slow down breathing, cause CO2 retention, put the body in state of respiratory acidosis. Now, let's do the last one, okay? I've explained so much, I'm just going to go into the ABG values. Our pH is 7.37. You know, that's the first thing you look at. The CO2 is 52, the CO3 is 33. So how best can we interpret this? Now, let's look at our pH first. Our pH is 7.37. Wow. So this is 7.35. We go forward, 7.35, 7.36, 7.37. Wow, our pH is normal. Normal. You see that? The pH is normal. Now, we're not done yet. We are not done yet, okay? We have to pair the pH with either the lungs or the kidney to be able to interpret it. So what you have to think in this situation is that, even though the pH is normal, but what side is it leaning towards the most? Our pH is leaning towards the acid area more. So even though it's within the normal range, we'll put acid, because the pH is leaning towards this is the acid side, this is the base side. The pH is leaning towards the acid side because we need to pair the pH with one of these. So we'll have our pH. This is a tricky question. This is a very tricky question. So we have our pH on the acid side because 7.37 given to us is closer to the acid side. Now let's look at our CO2. Our CO2 is 52. Now when it goes above 45, we lean it towards the acid. So our CO2 is also in state of acidosis. Acid. Okay? We find a match. We find a match for our pH. Now we have respiratory acidosis because we are dealing with the lungs. The CO2 is controlled by the lungs, so we are dealing with the lungs. And the pH is also in state of acidosis, so we have respiratory acidosis. Now we want to know if it's compensated, if it's fully compensated or uncompensated. Let's look at our kidney. The HCO3 given to us is 33. Now look, the 33 is leaning towards the base. Okay? So what do you think we have? We have fully compensated respiratory acidosis. You want to know why it's fully compensated? I told you when it's fully compensated, the pH will be in the normal range. Even though we put it on acid side to be able to interpret. But look, at the end of the day, the pH is in the normal range and the kidney is out of balance. It has increased itself to help neutralize the state of acidosis, respiratory acidosis. Now look at the lungs too. The CO2, the lung is also out of range. So to have fully compensated, right, the pH is the most important thing. When it's fully compensated, the pH must be in range, and that's what we have here. And both the kidney and the lung, they will be out of range, they will be out of balance. Why? Because they are trying to compensate for each other to be able to put the pH in range. So you see, the kidney increased its own base to help neutralize the state of acidosis the pH and the lungs are experiencing. I hope you understand it. I hope you get it. So our final answer, what we have here is we have fully compensated, because it's lungs, respiratory acidosis, because okay, I hope you get it. All right guys.